Hyperthyroidism is a condition where an individual's thyroid gland becomes enlarged due to an overproduction of thyroid hormone. We will be discussing two types of treatments for hyperthyroidism and their cultural and medical significances. Radioactive iodine is the most common type of treatment to reduce the effects of hyperthyroidism. Surgical ablation, or the actual removal of the thyroid gland, is an alternative to the radioactive treatment and is favored over radiation in some countries. We'll begin by examining a case study of a Japanese patient suffering from hyperthyroidism and analyze their condition through multiple medical perspectives.
My husband and young daughter are slowly growing accustomed to life in the States. I've had hyperthyroidism for 3 years. I went to see a doctor and she referred me to an endocrinologist. She proposed 2 options. The first involved thyroid removal surgery. It would be an intensive 3-day procedure. The second option was to take radioactive iodine pill, which would concentrate in the thyroid and destroy the thyroid with no need of surgery. I would be in and out of the hospital in just 1 day. She started talking about the risk of the surgery and the simplicity of the pill. In Japan, I've had friends with thyroid disorders, and all of them have opted for the surgery. The radioactive iodine pill is not even considered. In Japan, ever since I was a young girl, I remember the accounts of the atomic bomb. The depression and resulting fear she experienced has never fully left her. My father died due to the bomb. The exposure of radiation caused his cancer. I can't trust ingesting a radioactive substance. How can the doctors be sure it will only affect my thyroid? I want to have more kids in the future, and I need to be here to support my husband and daughter. I won't compromise my health with any unnecessary radioactive treatment. The radiation from the bomb left people with all kinds of horrific disfigurations and cancers. It caused my father's cancer, and he lost his life to radioactivity. Growing up, I always imagined what it would have been like for him to teach me how to ride a bike, catch fish, see me get married, and meet his granddaughter. Radioactivity and cancer robbed me of my father. I will not rob my daughter of her mother. I'm going to be there to teach her, to see her get married, and meet her children. The thought of ingesting a concentrated amount of radioactivity leaves me deeply uneasy. Whatever the risk of the surgery, I know I will not opt for the pill.
With the radioactive pill, she will be in and out of the hospital within the same day. The pill only affects your thyroid gland, and the radioactive iodine will be released through your urine. The pill is safe and will not cause cancer or impair fertility. It will be simpler and less invasive.
I have a new patient exhibiting the signs of hyperthyroidism. I have advised her to undergo thyroid ablation, specifically through radioactive means, but she insists on the surgery, which I don't understand because it's potentially risky and more invasive. Surgeries have complications, and this one is no different. You could have postoperative surgical seromas, which could be resorbed, but it might need to be aspirated, which is they put like a tube down your neck. You could have poor scar formation, which would damage your skin. You could have neck swelling, which would obstruct your airway, resulting in difficulty breathing. And other complications include injury to the recurrent laryngeal nerve, which could result in true vocal cord paralysis. And that's really bad because you wouldn't be able to speak anymore. In other words, a pill is a lot easier. You would avoid all these risks.
I got diagnosed with hyperthyroidism over a month ago, and I chose to take the pill. I've been on hormone replacement therapy since then. I chose to take the pill because I wanted to avoid being operated on because of all the complications involved, and also because recovering from the surgery might have taken some time, and I didn't want to be away from home or work for too long.
Japanese defer radioactive treatment or in favor of surgical ablation. This differs from the United States, who typically choose the pill form. The difference between these cultures comes from the fear attached to the bombings at Nagasaki and Hiroshima. The notion has been passed from generation to generation.